So we're going to do a procedure now for a patient who has a condition called occipital neuralgia. That's a type of nerve pain or neuropathic pain where there's dysfunction of the nerve at the back of the head, right at the base of the skull. This is the nerve that radiates over the top of the skull and generally gives very unpleasant burning pain. So what we're going to do to start with is we're just going to clean up the area. So here we are right at the base of the skull here. And I'm just putting a little bit of chlorhexidine on this. Chlorhexidine is the antiseptic that we use. 7.5, please. And where the nerve runs is essentially midway between the occipital protuberance here and the mastoid process, and it's just basically halfway in there, right at the base of the skull where my finger is there, and that's going to be our target. So we're going to start off with a little drape over the area. Okay. So just do a little bit more cleaning. Make sure that's absolutely sterile. So first things first, we're just going to identify the bottom. You all right there? Just my finger. And a sharp little scratch coming there. Perfect. Well done. So we're just putting a little bit of local anaesthetic in the skin. The important thing with this is not to actually anaesthetise the nerve, because then you can't actually locate it, which causes all sorts of other problems. Okay, a little bit of pressure, very good. So this is a radiofrequency needle. This one's about 5 centimetres long. It's insulated all the way down to the tip, and the tip is uninsulated. And we'll be putting electrical current through that to stimulate the nerve in order to locate it. Locate that as close to the nerve as possible. Should be able to get within a couple of millimetres of the nerve. Now you're just going to feel a sort of dull pulsing sensation, okay, to start with. So just tell me when you start to feel that, please. Sensory, please.
Okay, starting there.
Anything? Nothing? No problem. It's there, isn't it? How's that? Okay, that's fine. Okay, and let's just put one, slide this one next to it. A little bit of pressure. Perfect. So we've stimulated to locate the actual nerve. What I've done here is I'm just slid another radiofrequency cannula next door. So we've actually got one on either side of the nerve, and we're actually going to put the current between these two cannulae. This is called dual RF, or dual pulsed radiofrequency. Let's just pulse, please. And the treatment cycle is about 3 minutes. That beeping in the background is just the machine counting down. All right, let's go for that again. So we go for the sensory. Try it on one and then try it on the other. All right, just tell me when you feel that. That bit there. Excellent. Okay, pulse it, please. Okay, here we go again. Should be getting duller with each time we go round. Awesome. Okay, just the motor. Let's just see what twitches. You might find the back of your head twitching a little bit there. So around about there. How's that? Sorry?
Not too bad.
Not too bad.
Oh, yeah.
There.
Yeah.
Perfect, perfect. Okay, so we're on target. Off, let's pulse that, please. So we're just going to put, we've finished the radiofrequency procedure, so I'm just going to put some long-acting local anaesthetic and a steroid preparation around it, sort of belt and braces, so radiofrequency treatment and this. Some people who say you should either do one or the other routinely, and I've done both. They both have different mechanisms by which they work, so, and it works. Right, okay, so you're right there?
Yeah.
Just a little injection there, a little bit of pressure.
Yeah.
Now you will have a little lump at the back of your head, that's normal because there's some fluid in there,
Yeah.
and that will take a day or two to dissipate.
Right.
But procedure went absolutely fine, no problem whatsoever. Again, just shake it to make sure that the steroid preparation is in a crystal form, so need to make sure it stays in solution. Okay, that's that. And we'll just put a little bit of local anaesthetic in the area on the way out. Let's just do that, and that's done. Lovely. Thanks, everybody.